Even though I really wanted to talk about other type of dementias, I'm going to start off talking about Alzheimer's, because I understand, I know that most people here want to hear about that. And when I'm done talking about Alzheimer's, I'll talk about two new trials that came out within the last 3 weeks that may mean that everything I'm telling you today is incorrect. But I'm going to tell you what we know right now based on our best knowledge. But unfortunately, it's a dynamic world, and our thinking for the last 10, 12, 13 years, some of the evidence may be pointing in a different direction now. So with that, I'm going to talk about Alzheimer's again, which is the most common cause of dementia that we see. At the end of the talk, I'm going to talk about vascular dementia. Just when I look back over the last couple of years, I know that there's been speakers here on vascular dementias. And then I'm going to concentrate on frontal temporal dementias, and I'm going to put Parkinson's and Lewy body dementias together, even though they're not the same thing, they're distinct, but they present very in a similar fashion, and it's a good way to kind of present them together. The frontal temporal dementias are probably the hardest type of dementias to deal with for a caregiver, for physicians, for everybody. And in Collier County, we do a very good job at dealing with them. And when I mean we, I mean the Sheriff's Department, because the frontal temporal dementias, they present with a lot of behavioral difficulties. And a lot of times these people aren't criminals and they shouldn't be treated as criminals, but they should be treated as they have a medical illness. And we do a good job here trying to distinguish between those. So I always like to start off with dementia, because we always get somebody who comes to our office and says, Mom doesn't have dementia, she has Alzheimer's, or vice versa. And so dementia is basically like saying you drive a car. And Alzheimer's is like saying you drive a white Honda Pilot. So Alzheimer's is one type of the dementia. But dementia basically means out of mind, and it encompasses all the different types of memory difficulties. And even though today we're only going to talk about 4 types of dementia, there's probably over 60 different types of dementia. But 4 of them make up the bulk of what we're going to see. And again, Alzheimer's is the most common type that we're going to see. So we're going to talk about Alzheimer's, vascular, Lewy body, and frontal temporal. Just for completeness' sake, these are probably the next more common ones you're going to see. And I grouped Parkinson's with Huntington's and HIV. And the way we tend to think at them as healthcare professionals, we break everything up into geography. And so we think about cortical and subcortical. Cortical is the outside part of the brain, subcortical is the inside part of the brain. So Alzheimer's is a cortical dementia, Parkinson's and Lewy body is a subcortical type of dementia. And I know that doesn't mean anything to you, but the patterns of memory tests we see are distinctly different. So if I had somebody with no history and I was given memory test, I can tell the difference between somebody who's got Alzheimer's and somebody who's got Parkinson's. But I couldn't tell whether they have Parkinson's or Lewy body. I would need the medical history to kind of put that all together. But on tests, they just test so differently, and that's how we tend to think about them. We've known about Alzheimer's disease for well over 100 years. We all know how expensive it is. It's the 3rd most expensive illness, and part of that is the amount of care that's required, whether it's nursing home care, caregivers, stress on caregivers. And so in 2012, it was $200 billion. And you think about it, that our budget in Florida is about $300 billion. So almost a whole budget for a whole state. 5 million are afflicted in 2000 and 15 million by 2050. And obviously, the biggest risk factor for Alzheimer's is age. So as we age, we're going to get more of the disease. And with the baby boomers reaching healthy age, we're seeing more of it. When we look at the prevalence of it, and this becomes more important than usual, you see at age 60, it's 1%. And every 5 years, it doubles. So that by the time you're at 85, it's about 30% of the population have Alzheimer's. The history becomes important because the frontal temporal dementias tend to present at an earlier age. So we classically see those in the 50 and 60-year-olds. And that's not to say you can't get Alzheimer's in the 40s and 50s and 60s, but usually if you're getting Alzheimer's at a young age, it's due to a genetic defect. And the two most common that we see is presenilin 1 and presenilin 2. And those run in families. So, everybody knows everybody in the family starts to have cognitive issues in their 40s and 50s. This is a slide that I borrowed from Garry, and it just kind of looks at the incidence of all the different dementias. And you can see 65% is what we call pure Alzheimer's. 10% is a mix of vascular dementia and Alzheimer's, and then you have another 5% which is Alzheimer's and Lewy body. So, about 85% or so is going to be Alzheimer's and Alzheimer's plus. And then the rest is all these other things. You could see frontal temporal, progressive nucleosuccular palsy, which we see in cortical basal degeneration. We really don't see much CJD disease. And Binswanger's disease and multi-infarct dementia, there's a big overlap. We tend to think about multi-infarct dementia as big strokes and Binswanger's as small little strokes, and they can present a little bit different on memory tests as well. One of the striking things about it is because with the new modern healthcare system, doctors go very quick. And the byproduct of that is somebody with severe dementia, only about 60% of the patients are being diagnosed. And these are people who could barely have a conversation. And so how could they not being diagnosed? And unfortunately, we hear this all the time in our office, is if there's any type of cognitive issue, and you could be of total sound mind, if you're 90 years old and there's a daughter in the room, the doctor looks to the daughter. And then they don't get a history because the daughter's giving them the history. And it's part of the ageism that we see in society. And I recently had somebody in my office who refused to go back to a urologist because he didn't look at her once. He looked at the daughter the whole time. And obviously we need to address our patients, and even people who have Alzheimer's, even when they're very demented, I look them straight in the eye, even though I know they're not getting anything. And then the daughter or the son is in the room hearing what's going on, but it's out of respect. And even only about 1/3 is actually treated. So we don't do a good job at recognizing this disorder, and we even do a worse job at treating it. So how does Alzheimer's present? We all know it. The most common thing is problems with memory. And how does it present? You can see problems with orientation. People, they get mixed up on the seasons, especially down here. And if you're up in Boston and you have 2 feet of snow and you look out the window and they say what season it is, everybody says winter. When you're down here in February and you look outside and it's 84 degrees, you say summer. And so you get a disorientation. Obviously, people with normal memory know it's February, so it's in the winter. You also get aphasia, which is the language difficulties, and sometimes this is subtle. They call a pen a pencil, things that we all know the difference between, but when you start to develop memory difficulties, you kind of start to mix up the words. And I'll briefly talk a little bit about there's a special type of frontal temporal dementia called primary progressive aphasia, which is really the hallmark of language difficulties. Apraxia is the ability to do route activities. Brushing your teeth in the morning. You're not sitting there saying, I got to put the toothpaste on, I got to hold the toothbrush up, I got to go back and forth. You just do it. And you've been doing it for so long. And that's what apraxia is. So people who have Alzheimer's, they start to develop apraxias. So their hygiene starts to go. They don't do a good job of brushing their teeth. For a guy going to the bathroom, unzipping the pants, that's apraxia. And so sometimes you could start having more incontinence and stuff like that. That's unrelated to the memory, but it's these route motor activities we do. They may have problems swinging their golf club. That's another example of an apraxia. Executive dysfunction is really important, and this is one of the keys. You see a lot of issues in some of the Binswangers, the small vessel disease, and we see this in older people whose blood pressure hasn't been taken care of. And executive function is important because this is our ability to make good decisions. So when we have all the information in front of us and there's a good decision to be made, if you have executive dysfunction, you can't really see where the good decision is. And this is how sometimes with people with Alzheimer's, they make bad decisions, and It gets the sons and the daughters really upset. How can they be making this decision? And it's that they're not able to process all the information in a good way.